Dr. Jim Crichton, a geneticist who has dedicated his career to uncovering the genetic predispositions prevalent within the isolated Scottish island communities, is advocating for a significant reallocation of community benefit funds towards widespread genetic screening programs. His impassioned plea arises from his first-hand experience with hemochromatosis, a debilitating disorder characterized by the insidious accumulation of excessive iron in the blood. This condition, which he himself suffers from, manifests in a range of debilitating symptoms including chronic fatigue, unexplained weight loss, and persistent joint pain. Left untreated, hemochromatosis can lead to severe complications such as liver cirrhosis, diabetes mellitus, crippling arthritis, and potentially fatal heart failure. His diagnosis, a result of a family member's urging after years of struggling with debilitating symptoms, highlighted the critical need for proactive genetic screening. Crichton's research has uncovered alarmingly high incidences of specific genetic disorders within these isolated island populations. His findings reveal a stark reality. The limited resources and accessibility of comprehensive genetic testing are leaving vulnerable individuals undiagnosed and untreated. He argues that a proactive, population-wide approach to genetic screening, specifically tailored to the unique genetic profiles of these communities, would prove to be both cost-effective and life-saving in the long run. The current system, he contends, is woefully inadequate, with limited public funding allocated to such initiatives. He points to the single publicly funded screening program, the JBRCA gene screening for inherited breast and ovarian cancer within the Jewish population of England, as a stark example of the insufficient investment in preventative genetic health care. The substantial cost of managing the consequences of untreated genetic disorders far outweighs the investment required for preventative genetic screening. Early diagnosis allows for timely intervention, minimizing the long-term health complications and reducing the overall burden on the National Health Service, NHS. Crichton's research on the Shetland Islands, for instance, has revealed a startling statistic. 1 in 40 islanders carries the gene for Batten disease, a devastating neurodegenerative disorder leading to premature death in affected children. This alarming prevalence underscores the urgent need for comprehensive genetic screening to identify carriers and provide couples with crucial information for informed reproductive choices, thus preventing the devastating consequences of this fatal illness. Crichton emphasizes that his proposed shift in resource allocation would not only represent a significant advancement in preventative health care, but would also lead to substantial long-term cost savings for the NHS. By identifying and treating genetic disorders at their earliest stages, the NHS can prevent the development of costly and complex secondary health problems associated with these conditions. The investment in widespread genetic screening represents a forward-thinking approach to health care, prioritizing proactive intervention over reactive crisis management. The cost savings accrued through early diagnosis and treatment would significantly outweigh the initial investment in large-scale genetic screening programs. His call for a redirected focus on preventative genetics, tailored to the unique needs of isolated communities, offers a powerful argument for a more proactive and cost-effective approach to healthcare. The potential to save lives and alleviate suffering makes this a compelling proposition that warrants immediate consideration.